Well, I'll have the honor to invite my dear friend, Mr. Eyal Baum. He is the Director of Strategic Account at Title Care. As I told you before about the huge saving of telemedicine in Clalit Health Services, so Eyal is a part of this success. Uh, so please, Eyal.
Hi, Jackie. Thank you for the honor in presenting our product today in this webinar. So I'll be glad to show you an overview about Taito. Just to make sure, can you see my presentation?
Yeah.
Let me run again. Okay, now I think it's better. Perfect. So I'll have the next 10 minutes describing our product, our company, and give you some insights about our activities in Israel and around the world. So just as a background, Taito Care, as Jackie mentioned, we are a startup company, already 8 years exist, but 3.5 years on the market. We're in the telemedicine world, which now with COVID is, let's say, the most one of the hottest trends and one of the fastest growing areas in healthcare. So I'm sure this is clear to you. So to jump forward about Taito's value and about what makes Taito unique. So if you look at telemedicine, which today is very common everywhere in the US, India, Israel, and around the globe, when you talk about telemedicine, I'm talking about primary care mainly. Today, most telemedicine is provided, what is telemedicine? Connecting patients and doctors remotely. And usually this communication is done over a phone, and today it's very common to do a video call. But if you look eventually what a video call provides the doctor and the patient, you see that it is still very limited when compared to what you get in a clinic, in the physical world. So this is exactly where Taito is bringing to the table. This lack of this gap between the physical world in the clinic and the virtual world leads to a lack of trust, leads to a very limitation that causes doctors not to provide the full treatment, not to provide the prescription, not to take risks, and eventually to create some disappointment by the patients and by the consumers. And this is what we at Taito is trying to overcome. We have developed a set of connected devices, basically a health kit, that enables a remote physical exam. Meaning we have a set of connected devices, the doctor can control them, examine the patients, get the confidence they were looking for, and really provide full treatment, save the physical visit, and save the costs associated with doing a physical visit. And if you tie it up with a trusted provider, you really manage to replicate what you get in a clinic. And this is what Taito is all about. So a little bit to explain further about our product. So you see here, we have a set of connected devices, basically 4 devices. One is a digital stethoscope that enables auscultation or listening to the sounds of the heart or lungs or even the abdominal sounds and measuring heart rate. We have an otoscope to look at the ears, diagnose ear infections. We have an examination camera with a tongue depressor for throat imaging. We have a thermometer for body temperature and a skin camera for dermatology purposes. But in addition to all this set of connected devices, this kit, we have a very unique platform that connects and allows remote control of these devices by the remote physician. And moreover, this platform supports and provides guidance and navigation capabilities that allows not only nurses or paramedics, but also consumers, patients, the elderly, to do those type of examination. So if you look at our platform, so we both provide an end-to-end solution for telemedicine, including video conferencing and scheduling. We have a mobile app at the patient side, clinician app, both enables them to communicate and moreover to perform this physical exam in a diagnostic quality. Of course, the platform is fully secured and we have a lot of integration capabilities. We have a very flexible API that allows us to either go as an end-to-end solution or side by side with other platforms or to connect with the medical record. In terms of method, one option to to connect patients and doctor is offline, asynchronous. And then we are using our AI capabilities to guide the patient, to help them, to give them feedback, and to validate that the data being captured is in diagnostic quality. So this is the offline. And another option is online, which is even more common today, that the doctor is doing a video call with the patient. And as you can see, in parallel, data is streamed in real time from the device to the physician that allows him to see the images, sounds, and vitals. I will show you a quick video later on how it is done. In terms of products, so we have basically two product lines. One is the Tyto Home, which is more for home use, for families, but not only families with kids. Also, we see now with the COVID, many elderly patients now buying Tyto as they do not want to come into a clinic. We have partners who use Tyto for chronic patients, for remote patient monitoring. And of course, also with COVID patients, mainly in home hospitalization, patients with more mild symptoms that can be treated not within the hospital. In addition, we have Tyto Pro, which the devices are quite similar, but the platform is designed for other use cases, more professional use, where the platform is used in much more frequent use. And each of our partners using Tyto Pro in a bit different way, some in a home care setting, or by traveling nurses that are going to homes, remote clinics, which of course could be very relevant to India, in areas, in rural areas where you do not have a doctor. And instead of bringing a doctor or bringing the patients in the same room, we can provide access to doctors in many areas. Pharmacies, we have a few projects with pharmacies that enables the patients to come into a pharmacy and get online with a physician, schools, employers, ambulances, and more. So in terms of our market presence, so as I said, we are active and we got the FDA clearance 3.5 years ago. So since then, basically beginning of 2017, we began our footprint in different markets. We have started in the US, and this is still our main market. You see most of our partners, of our customers are at the US. We have an office in New York, but we gradually expanded also to Europe and starting now in Asia as well. And as Jackie mentioned, Clalit is also one of our biggest partner. Clalit is second largest HMO in the world. They have 4.5 million members, and they are doing telemedicine for quite many years and expanded it with Tyto. So if you look at our partners, Tyto is working on a B2B mode or B2B2C, meaning we are always partnering with a health provider or some health insurer that want to either implement or expand their telemedicine offering. So you see here health systems from the US, Thailand, Samitivej or BDMS is our partner in Thailand, Sheba and Clalit in Israel. We have clinic chain, employers, and insurers. You see insurers from the US, Europe, and Asia. Pingan is one of our investors. I want to show you a quick video in the time left showing the experience of Tyto. This is a video done by Sheba Medical Center. I hope you can see it. The sound is in Hebrew, so I'll mute it and I will try to explain in English. But basically, this is a good example how hospitals or health system can monitor patients at home. This example is related to a COVID patient, but of course, any chronic disease or any type of home care could be relevant. You see the patient is getting the Tyto home hospitalization kit. The patient logging in, of course, the system is secured. He's doing a video call with the doctor in Tyto platform. So this is the platform. You see with the video conferencing. And now the doctor is getting remote control of the device. Okay, so the doctor is in charge. The patient can feel confident and relaxed. He's not alone here. He's doing it together with the doctor. So starting with the vitals, he can measure temperature, he can measure heart rate. We can integrate with other devices like blood pressure. So you see the doctor is seeing exactly in real time what the patient sees. So we can tell him, open your mouth wide, stick out your tongue, say ah, listening to the lung sounds, heart sounds. Lungs is very relevant to COVID patients. You know, the hospitals making sure the patient's condition, the lungs, are not deteriorating, so they can identify it, and if needed, breathing. So you see he's listening to the lung sounds. You see also the guidance on the app. So we are helping the doctor and patient to do it in a very convenient and efficient way. So here you can see the doctor can rule out any type of infection in the lungs, or in the throat, or in the ears, or in the skin. And this gives the hospital a confidence that they are not taking risk by letting patients get out of the hospital and go to homes. And we see, by the way, very good adoption by Sheba, also at care homes. By the way, not only in Sheba, also in Europe, we have several partners in Switzerland, the US, Italy, the UK, that have built like a service of nurses that use Tyto for care homes or to monitor COVID patients. And also in Thailand, our partner, Samitivej, implemented Tyto in many hospitals that use Tyto both within the hospital in quarantine areas and for remote monitoring and home hospitalization projects. That's it for my side. Jackie, back to you.
Great.